hello everybody. Sorry we're a few minutes late getting started. I invite everybody to take a seat, make yourself comfortable here please for today's session. The only housekeeping I have is just to ensure that your mobile phones are either off or on silent. And I would ask that during the Q&A, if we're entering or exiting the room, just to try be as quiet as possible. So our first speaker is Joanna Lawicka. Sorry, I've just made a mess of that. And Joanna is a doctor of social science. And today's title from Joanna is Trauma Treatment and Mental Health Care Programme for People on the Autism Spectrum, a Chance for Health and a Better Life. So if we could just welcome Joanna, and we'll get started. There will be a short presentation and then an opportunity for hopefully a few questions. Thank you.
Good morning. I'm very happy to be here, and I'm very stressed, really. So my English is very funny, so enjoy. And I will talk about the trauma treatment and mental health care program in our program in our foundation. You know, we interrupt the flu over the cooked nest. I guess I would like to do it. And this is a very important part of our job in this moment on our organization. So I would like to show you what we are doing. This is the first moment. This photo you see was in every newspaper in Poland and in every media. Is a young adult, I guess, young man, autistic with intellectual disability, and he spent 7 years in the hospital like this. He was diagnosed very early. He was a long time in the some clinics, some special center for the autistic kids in our country. And he had a very great therapy. You know, I have seen his history of treatment because I don't know who, some random person sent me this. They sent it me from the early morning, a lot of messages like this. Please help this boy, but what I could do? He is in the hospital. I am in our center on the south of the Poland. He is on the north, and he is in the hospital 7 years. What I can do? Nothing. But we started thinking about this, that similar people is a lot, I guess, a lot in every places, every hospitals, every centers, every special schools. People who had in their history that they don't answer on the therapy. Of course, you know what the therapy I'm talking about. So this was a very sad moment, and I felt really very bad because I couldn't do anything. This was absolutely too much. So we started thinking very much about the construct at healthy person on the autism spectrum. What does it mean? What does it mean that you are autistic? I'm also autistic. What does it mean that we are healthy? Could you be healthy when you are autistic? And I'm sure that it's possible. And I will not talk a lot of the mental condition of the autistic people because you know this very well. Today's on these conferences we was talking about this. I have been on a lot of lectures about this problem, so you know this. It's a very bad, it's really bad situation. And please look at this, that in a lot of places we have information that we have not a good research about this. Because you know what we have in the studies. We have a lot of really very strange things, like what is the reason of the autism? Maybe this is a stomach, maybe it's a vaccination, maybe it's something. But people are not really seriously talking about the mental health, about the physical health also. If we understand that our autistic condition is another condition than of the majority of the population. So we should understand also that our body and our mind, our health needs are a little different. We need maybe something special to be healthy. In this moment, this condition is really very tragic. And I really hope that in the future could be different. Then this is not a problem with autism. It's not something like that. If you're autistic, you have to be sick. This is looking like we have to be sick. But I believe that this is not true. I believe that we could be healthy. And it's very important to me to say that we cannot talk about autism and another problems. No, we should talk about this, that autistic people could be sick and that they need help and they deserve on the help, good treatment, not autism treatment. It's I'm sorry, bullshit. We need to talk about the real, truly special medical needs of the autistic people because they have some problems more often than non-autistic people, not because they are autistic, but because they experience, because their life, maybe because they genetic also. We don't know a lot about the genetic condition of the autistic people. We know more and more. Every year is coming with new information about this. But it does not mean that we know everything. We should know, but we need to wait for the future. Trauma is a big problem in this. I guess that on the background of a lot of mental problem of autistic people, we have a trauma. In our center, we have a big program of the diagnosis. I will talk at the moment about this. And can you imagine that probably in the 90% of the adult people we have on the diagnosis processes, they have a trauma. This does not mean that 90% of autistic people have a trauma. It's not true, because we have a special group of people who are coming to us. Special people who are really feeling bad. But the research about the trauma in the autistic population are not very funny. And what is also very important, you remember this photo from the first slide, yeah? This was an autistic boy with the intellectual disability. So we have also a research are showing that 60% of similar people like this young man, boy, they have a strong trauma. We cannot not thinking about this, we should think about this. So this is our team. When we decided to provide this, I think that first in the Poland, but probably also one of the first on the Europe program of the treatment of trauma and mental health care of the autistic people, we had not so big and good team, but now these people you are seeing there, they have really very, very good specialization. And what is very important, they all have 10 or more experience with work with autistic people. And they all are thinking about autistic people, about autistic population in the neurodiversity concept. So they connect this knowledge about the development of autistic people with knowledge of the clinic psychiatry, clinic psychology, and the rest of the specialization. I'm very proud that now we have 3 EMDR therapists and they can help autistic people. One of the young men, he is now 17, and he needed this type of the therapy from the 3 or 4 years. I personally was asking every one therapist from our city about this, and nobody wanted to work with him because he is autistic. So this is some special diagnosis program were provided. So it's not like, some one meet with the doctor and one meet with the psychologist. It's a long process with a lot of tests, a lot of procedure, because we understand that it's not easy to diagnose very well autistic people. Also, you know this also very well that we have not the best tools for this population. So it's also very important, this knowledge about the autistic development. So in our treatment program, we have a lot of things. We have a very good psychiatrist also with a long time experience with autistic people. And they also know that autistic people reaction on this medicine are not typical. So they are very, very careful in this process of the treatment. And also, we have our own method of the psychoeducation, because we believe very much that what is happened on the environment of the autistic people is the most important, because this is a background, this is one of the big, of the much more important reason of the condition in the mental health of the autistic people. So is the Jack. And when he came to us in the 22, he had a really very, very bad story. And he was extremely aggressive. Nobody wanted to work with him. 15 years old boy is a big man and a very strong man. And this is Anna. Anna was a person in the past with a really typical intellectual level, but he has a schizophrenia. And schizophrenia is a very dangerous for our cognitive possibilities. This is her words. She told me, please tell everybody what's happened in my life, because maybe people will not do something similar another children. She also have been in the same center, this boy from the first photo. She have been in the same place. In the both cases, we made the diagnosis, we started treatment. After 3 years, we have a situation that they both have some program. They participate in this program, and now their life is really, really better. I know we have 2 cases, but it's not all. We have a lot of people in the program in this moment. In every month, we have a complex diagnosis for a lot of young and adult people. So this is what we need. I believe this very strongly, that we need to cooperation. We need to build some global standards for the diagnosis and treatment of autistic people in the trauma area, in the mental health area. So, thank you very much.
So we could squeeze in one quick question if anyone wants to raise their hand. Yep.
I think that it was a great presentation. We have to deal with the trauma, what caused the trauma. And part of causing the trauma is stigma. The trauma that we see, people come to us, it comes from the behaviorist, from the ABA. So yes, we have to deal with the trauma, but together with that, we have to start and talk about what caused it. And I think that the people that are coming over here from the academia, they need to take responsibility about the research that they're doing. Because a lot of this research, it just gives stigma. Instead of addressing different people, which are human beings, and need to live like anybody else, like what we saw before about self-compassion. So this organization, Autism Europe, and the people that come over here for the research, you have to take a responsibility about it, So you will not see this kind of pictures. The one that you showed at the beginning of this young man being strapped to a bed for 3 years.
So thank you very much for this voice. I don't know what I should to say for this. You know, for me it's very sad that something like what this young man had in this his life, and this Anna, Jack, and everybody, their behavior, what is a symptom of the trauma, the symptom of the mental problems, was addressed to the autism. It's very sad. And I'm sure that we have a big responsibility to change this.
Thank you for your statement, and thank you, Joanna, for sharing that and for sharing the details of the young people. It was very powerful.